Welcome back. As we head into the new year, we're learning more about the different options you can find for medical weight loss. Dr. Peter Lalor joins us from the Center for Weight Loss Surgery at Wood County Hospital. All right, thank you for coming back. Thank you for being back. This is a time of year, obviously the new year, when people start thinking, oh, they want to do all these new things and they want to try all these different things. Weight loss right up there among the chief concerns, right? And especially here this time of year, isn't it?
Absolutely. This is the time of year, right? What better point in time to start our New Year's resolutions? Weight loss is the top of that. And basically, you know, there's lots of options out there. And whether it's doing it on your own, going to see your doctor, looking at medical options, or even surgical options, sometimes it can be quite confusing to what's out there and available and what's right for you.
So you at Wood County and the people in the office, I mean, you guys are the pros here, because there are some people who think, oh, I see this thing on TV, I just go buy a vial of it and I just shove it in my stomach and I'm good. That's not necessarily the way you want to go, is it?
No, I think one of the biggest messages is it's really hard to do this alone. And one of the benefits of a program like ours is that not only do we present you with all the options, you know, which includes using a dietitian, behavioral therapy, sometimes using medicines if there's appropriate, or even surgical options, but it's a team. And it's that team approach that is going to give patients a better chance for success. For instance, you know, if I said, here's a shot, good luck, you might do okay with it, you might do okay for a short period of time, but in the long term, is that really going to give you what you need? Whereas for us, we say, look, we're following you around, per se, and we are the team around you that's holding you accountable, you know, making sure that we're doing this safely as well, and giving you multiple avenues so that you can address your appetite, you can address how to exercise, you can address how to think and how to motivate yourself in this new year to accomplish the goals that you want to.
Because isn't that the biggest problem, though? I mean, taking the weight off, it's a difficult journey, but keeping the weight off, that's the one, right? I mean, that's why people like you and your staff are so valuable, is to help people with keeping it off.
Absolutely. That's really why I'm in business. People can lose weight many different ways in the short term, but it's really the long term that is the most challenging thing. And, you know, identifying what route is right for you is really crucial to being able to determine whether you're going to get those long-term success. And it's really learning those habits, not just about diet and exercise, but that brain game as well, and any other adjuncts like surgery or medicine that you want to do long-term that's going to give you the benefit to maintain that weight.
What are your thoughts on, there's all these medical breakthroughs lately. What is, as a professional, as someone, this is your business, this is your forte, what is your thought about having so much access to these now over-the-counter drugs?
Yeah, the research is amazing, and the medications out there, they are really good, and they've gotten better and better every year. They're not without their side effects and interactions, and some of the long-term data is not clear to what these effects might have with us. But in the right candidate, which is really important to be the right candidate, these medications can be very effective if they're combined with diet, exercise, and again, that kind of behavioral, psychological aspect to lose weight over time. If you don't have that stuff, then okay, you might lose weight in the short term, but you may not be successful in the long term. And I might add to that as well that there are patients and people out there that they kind of are attracted by the shot on TV or whatever, and they say, oh, I can do what that is. But when they have a weight problem that's significant, you know, say they're over 100 pounds overweight, then they need to really look at other options, and surgery then is the option that we recommend to them.
You've been doing this for a while. Is this maybe one of the biggest breakthroughs that you've seen as far as accessibility for medicine in your career?
Absolutely. I mean, again, the research is amazing out there. They've gotten very good at trying to fine-tune how to affect our metabolism and affect appetite and affect satiety overall. But again, you want to do these in the right way, and you want to have it supervised by medical professionals and a program around you that's you know, that's looking out for you in your best interests. And again, trying to teach you those habits that are going to continue this success long term.
And that is why you and your staff are there at Wood County. What is the proper way? What's like the first step? Is it a phone call? Is it online? How do we go to you first, and then what happens after that?
Yeah, so I mean, outside of the first step of wanting to do something about your health or just wanting to feel better overall, you know, patients can call the office if they're interested in the surgical pathway. We have a free seminar that we offer at Wood County Hospital that spells out all the options to people. And if they're interested in medical weight loss, we ask them to make an appointment, and we sit down face to face and we go through all the options that we have out there, and we try to direct patients to what's right for them.
That's Dr. Peter Lalor of Wood County. Thank you so much. Appreciate you being here. And again, you fantastic story. Spend 5 minutes talking to this guy, and you feel smarter already. Thank you. I needed this for this year.